Yeah. So I would love to, I think Maha said we're taking looks like we have some questions in there.
The question that I had in there, because I know that there are great variations between and among the counties in the Bay Area. So, is there any particular guidance that you would give for what are some useful words to say if a family member is really concerned about a loved one in a mental health crisis, and they're seeking some assistance, but they want to really do what they can to make sure that whoever responds to that call has some training in mental health de-escalation. So how best to ask that question in that critical moment?
I mean, are you asking for, okay, so I think that from what we described just recently, I think the continuum, if you call 988, they're gonna know, they're gonna be trained. If you call A3, the mobile crisis team, like you just gotta literally just say, I need help. I mean, they're trained, but I think if you're talking to someone that's not trained, if that's what you're saying, or a 911 officer, like, and I have done that before. I mean, I literally say this person is not they if they are, but I mean, I literally, for me as a black person, I literally tell, like, if I'm calling 911, I tell them, like, I try to use words to say that the person is not a threat to other people unless they really are. But and describe, in words that we want, a non lethal response. I'd like a minute. Like, so I work with the sheriff of Santa Barbara. He is actively committed to having clinicians and officer co-response in his county. And he wants all his members trained in his jails and peer support specialists. So I think that when you call a lot, like say, for example, that county, they're going to know, they're going to be trained. Um, so I think that that's the advice. I mean, I'm not giving advice, but when I've called 911, and most recently when there was someone in my neighborhood that was, exhibiting, irregular behavior, I did call 911, but I'd call 988 at the same time. But they're in LA, they didn't come for like an hour and a half. And I told the police the person was not harming anyone. I wanted a non like I wanted mental health folks, but 911 came faster and then she was arrested. And then 988 called, the mobile crisis team called me later, and I said she's been arrested. So, I mean, I try to plead with them to, like, I don't know. I think sometimes it's you kind of have no words, but Dr. G, do you want to add to that?
Yeah, yeah. And I appreciate what you're saying because everything's not perfect. But to your question, Fred, I think there are a couple of things if you are aware of, like, if you're the cognizant person making the call, asking the police officers to come without their lights on or without noise. That tends to be like, can you come in? It's a residential area. We have kids playing. Can you just make sure that your lights are off and that you're not um, loud because that can be agitating. Or sharing that there's not a lethal threat and this person needs someone to talk to them or someone to kind of talk them to help them calm down. They're just really emotional right now. So using easy to interpret language. So de-escalated can be a big phrase depending on the situation that you're in. And it also can make people think a certain way. So if this person is escalated and they're going to hurt someone, they're running around, they've got an axe and they're just like yelling to the hills. But if you just say they're just really emotional right now and they need someone to talk to, that tends to alleviate some of the stigma around the perceived harm of a call like that.
I really appreciate that, Dr. G, because that's why we also, Ton and other folks were working on the psychiatric advance directives. which is to your point, Dr. G, you just gave the county their psychiatric advance directives. We got some trainers on the call because that's a part of your psychiatric advance directive as an individual. That's a document that you use to plan before a mental health crisis. And as someone that has been arrested in LA County, cops came with guns blazing. And I'm just being honest, cops is coming guns blazing. And I just hope 988 is because I had cops comes in, but my psychiatric advance directives do have people to not, speak on my behalf. It does, talk about me being traumatized. It does talk about how I've, had interactions and how I want to be engaged with the cops, and that's happening in some counties right now. Contra Costa County is a county that is pilot in that project. So if you're interested, connect with Grace on the call. Angel Tan is also a part of the project. But that's a project at your county that you guys can get involved in now that you can have a psychiatric advance directive that can give you all those preferences that Dr. G that talked about. And the cops, they're training the crisis professionals in your county right now and in other counties like Alameda and working with crisis professionals. So the advocacy with Mouse Hall and other folks with Painted Brain is really, like we said, building that continuum. So like you have 988, you have 883, you have the psychiatric advance directives that's happening in Contra Costa. And now we're learning language together. This is what peers do. This is how we get on the call, and this is how we learn through our lived experience how best to navigate that. And you have a great question, Fred, um, and if you need more support, Painted Brain's always available, and the Mouse Hall Foundation is as well.
Yeah. Thanks. Yeah. So, yeah, Maha, was there another person you want to see if they want to share their question?
I think Atari had a question.
Oh,
I don't
Hatari.
know.
Yeah, he did, huh? Thank you. Yeah. Hatari, you still there?
Excuse me, everybody. I'm out amongst my people. I'm at work. I'm at work.
Oh, hi.
Wait,
So look, I relate to everything everybody said. Like I did 33 years in prison, so I get it. Like I had to shoot out with the police. I got shot by the police. I got a lot of I have a lot of trauma that I had to deal with even to get to it. I'm still dealing with it. Like, but
Well, thank you for sharing.
some I noticed something when I got out of prison. Like when I got out, it was at the height when everybody was feeling black. Everybody was justifying. Everybody like trying to say, "Oh no, this." They trying to tell us how to feel about it. And I couldn't just sit back and just hear that and like watch my people get shot here and there, and everybody just talking about it. It's a topic now because it's not the same public. Now our everyday life else. We've been telling everybody this for years and years and years and years and years. Going through something, we need help. We don't need you coming at us like this.
Right.
Come at us and help us. Don't come at us with guns blazing with your biases.
Right.
So when I got out of prison, the first thing I did, I formed my organization, the Warrior Healers Club. I'm like, look, I can't talk about it. I just got to do it. And that's it. So I just learned as much as I could possibly learn and move myself to that. And that's what I've been doing. Like, I ain't where I'm supposed to be, but I'm where I need to be right now in this moment. When I'm out here right now, I'm amongst my people right now. Like literally, I'm out here amongst the people. This is trauma healing.
Yeah.
This is real life. This is real life peer support. These little brothers out here want to make it like anybody else. But don't nobody, because everybody get in there with their bodies and what they see everybody else doing, but you see what this little brother doing. See them little tiny things that he do. See them little bitty decisions he making. They don't never see that though. So my thing, I'm like, okay, I can't talk about it no more. I got to do something. And so that's what I'm doing. Period. I can't say like, and I love that y'all even start talking about this. This is a beautiful thing to me to hear even people like that give a fuck about what we going through. And
Right.
yeah, I'm really from the streets. I'm really one of the catchers. Everybody be seeing us on the news and talking about it and oh, they're terrible. Okay, I'm from there. But the most important thing to me is my healing. Why? Because if I heal myself, I can heal my people. So all the healing I do, I take them with me. I walk them through that shit.
Thank you.
I don't. So, but anyway, that's what I want to say. I apologize. Like I'm amongst my people, but I had to be here, man, because like you're talking about something that I care about, and when people get to talking about something I care about, I really need to be present because like I know this. This ain't some shit I like theorize about. This is I live it every day. You
Well,
know, I
that's all
pray to
right. We
God
appreciate you.
every day and tell him thank you. So I appreciate guys for being here and all y'all doing this. Let's do it. That's all. Let's stay doing it.
Well, thank you, Hatari. We appreciate you sharing and also the work you're doing in the field as a peer. So thank you again for being on. All right. So I don't know if I can probably take one last question if someone had another question or a comment or anything that you want to share. Okay. Well, then yeah, I would just go back to you know, hopefully you guys have learned something new. Being with us today on a 5 o'clock on a Tuesday. Now it's almost 6:15. So thank you guys for all being here. Thank you for Dr. Jones and Rachel and Maha and all of you guys for being here today. But thank you guys all again. And you guys, can definitely also donate to the Miles Hoff Foundation and also the Painted Brain. Because that's how, we're able to, um, continue our work is through donations and people. But also, if you're not able to donate, spread the word, like our posts, right? Um,
Volunteer.
volunteer, yes, all those things, yes. All right, you guys. Anything else? Anyone want to share? Okay. Well, as I always like to say when we get off a call, say his name, Miles Hall. Miles
Miles
Hall.
Hall.
Miles Hall.
Miles Hall.
Thank you guys all for being here today. I appreciate you.